Hi, I'm the education consultant with Advanced Nurses at ACD for N, and I wanted to talk about my experience with transitions. So, when I initially became a nurse, I knew I did not want to work in the hospital. A lot of it was because I couldn't stand my experience in clinicals. The idea of being at a nursing station at 7 o'clock in the morning and just talking with people, being bright eyed and bushy tailed, and serving someone that early in the morning. Because when you're a nurse, you are a nurse specifically working in the hospital, your patient is your focus and patients are your focus. So for me, it I just couldn't see myself doing that long term. And so I didn't even start. I've never worked at a hospital before. And so exploring what I could do in non-traditional nursing roles was very much my experience. I've been a nurse for over 13 years, and it's really the only kind of nursing that I know. Now, many nurses have experienced either working in a nursing home or working in a hospital before they wanted to transition. So I didn't really have that burnout story, like working in the hospital for a year or 2 years or even 6 months and they said, I got to get away from this. I didn't have that experience. But my experience was more so kind of dealing with burnout coming from case management, like working out in individuals' homes or working out in the community. And that can be really draining. My heart goes out to nurses who are working in that capacity and they just have not met somebody like myself, or they don't know any other resources and don't know anyone who's not working in a patient facing role, because that's where I think we lose nurses and people transition out of the profession because they don't really know what they can do within nursing that is not patient facing. And so my services are really focused on nurses gaining new skills that will help them to have successful careers away from the bedside. And so I started my program and with a real focus on looking at 6 key points. I have these key points outlined as objectives over a 6 week period. And so I'm going to go through them today. So, looking at your professional goal. So, exploring how the role, whatever it is that you want to do, how it helps plan, coordinates, or evaluates care across settings, and looking at patient outcomes and experiences. I would say this is a good place for you to start because if you think about what it is that you want to do as a nurse, you already know you're going to have some patient outcome influence. This also helps you when you're interviewing because oftentimes in roles that are non patient facing, you are going to be interviewed by a nurse who has been in a non patient facing role for a very long time. In that capacity, they're not dealing with patients. So you want to be able to kind of think in ways of patient outcomes, even if you are moving away from the bedside. My own personal experience working first for a payer as a case manager, while I was no longer providing direct patient care, I understood the importance of having that therapeutic communication, having that patient centered approach, being sensitive to that patient's environment and what factors influence their health outcomes, such as social determinants of health. And so, being able to speak to that when you're speaking to a prospective employer is very important because they understand that you understand their mission. There is no part of the healthcare industry, whether you're patient facing or not patient facing, that doesn't result in improvement in patient care or an emphasis on quality of patient care. So if you have grown resentful of nursing to the extent where you don't care about patient outcomes, this is probably not the right program for you. And maybe transitioning away from nursing may actually be the best thing for you to do. But if you're still passionate about patient outcomes, but you no longer feel that you want to provide direct patient care, then health information management, health informatics, for example, are great places for you to transition to. Okay. System impact. Learn how your ideal role functions across providers and clinical settings. It's important for you to know how you will interact with providers. There are many different roles away from the bedside where you may have to maybe visit provider sites. You're not working with patients, but you're working with providers to help them with the patients they're caring for. So maybe you may be looking at that provider's panel. Maybe this is a specialty. So, for example, you're looking specifically at a provider's panel and the services being provided are like a monogram program, for example, where they're focused primarily on renal disease, right? So with that, you are going to have to improve your knowledge around that specialty area for for that practice, but you also need to be aware of how you are now going to have influence on that provider type and within that setting, whether it is an outpatient setting, acute setting, or whether it is within the community. You really need to know the kind of impact you're going to have in that system and what system you're going to have an impact in. Strengthen skills. I spoke about this before, but I'll just reiterate it here. It is important for you to know what skills you need to strengthen. I remember when I was working for a major health plan and I was working in a capacity of in a management capacity. And I recognized that I was working under leadership that was really uncomfortable with technology. And what I realized was that all the other stakeholders who were reporting from dashboards and reporting numbers and statistics, that this was an area that the individuals I was reporting to, who are in more senior positions, they felt very uncomfortable speaking to. Because they felt uncomfortable speaking to these numbers, they created an environment where they either made the numbers not important, so they were not actively seeking out numbers. They were not actively involved in reading the dashboard or driving productivity or processes around data. They made it more so focused on, uh, I guess, more reactionary. So if we were in meetings, for example, and maybe it was mentioned that something about our program or our process needed to be modified, they would prioritize their responses based on specifically what is being asked of them. Nothing more, nothing less. Specifically, what's being asked of them. And in times where they could try to redirect the attention to other folks, they probably would, oh, could such a one do it instead because of whatever reasons. But the truth is that they felt uncomfortable working with spreadsheets. They felt uncomfortable working with dashboards. They felt uncomfortable with statistics. And so therefore, they did not want to lead any changes that were data driven. They really just reacted to requests. So if there was a set of numbers that was being asked of them, they would just try to get the report over to whomever was asking, but actually doing their own analysis on that information, demonstrating that they understood their influence on those numbers was not a priority for them. So it's important for you to know that even if you get into a very high leadership role, it's just more responsibilities around managing data and data around KPIs, key performance indicators, data around how are you measuring in areas of quality. What are your processes that again lead to better health outcomes for members of that program or that health plan. And so this is where it's important for you to have you strengthen your skills. The collaboration is going to look different if you're working face to face with patients and your colleagues. It's very different collaboration than when you're communicating with somebody via email. It's that emails and even if you're direct messaging, depending on the systems you use, some systems use WebEx or Skype or Teams. If you're messaging someone, there's a way that you message that person to demonstrate that you and them are still on the same page, even if you are not directly facing one another. Even in institutions where people are using those processes. For example, if you're querying a provider as a clinical documentation specialist, you're using a query template, you're communicating to that provider. You're not necessarily seeing that provider like, oh, let's hop on a Zoom call or let's hop on Skype and have a conversation. In many cases, you're communicating electronically to that provider, right? So with that, you have to know how to communicate in ways where it's clear, it's concise, it's complete, it's understandable, it's very detail focused, and you're providing the kind of detail that's appropriate for the receiver. So, if the receiver is the provider, do they need to know all the inner workings of what's happening in the CDI department? No. Just speak specifically to the question that you are asking the provider. If it's a query, focus only on the diagnosis that you're querying for. So the communication and collaboration looks different when you're away from the bedside, but it is a skill that you will have to develop. I developed those skills in two different programs. I have been university trained in project management, and I'm also university trained in data analytics. In both programs, there was an emphasis on reporting using technology, using software that helps with reporting and looking at dashboards and looking at performance over time, being able to pull the relevant data and giving it to that person who is the recipient of that information is very important. People don't need all the details if they don't need all the details, right? So communication is very important, and learning how to strengthening your communication skills is very important. Educational opportunities. As I mentioned, I paid for my data analytics course. However, when I was university trained in project management, my employer paid for that. So it is important for you to know, what systems or programs or offerings are in place at the place where you work, and maybe your employer will see the value in you being trained. I remember reading something recently that there was a whole department that was trained, a Sigma green belt training. The whole entire department got that training, and they got that training because the company said, "Well, I believe that the company would run better if everyone was trained." So if you think about that, this is the kind of activities that you probably could embark on your own. If you see the value that you can add with a particular type of training, you ask your employer, hey, listen, I'm interested in project management. One thing about project management skills is that you can use project management skills everywhere. Everything is a project. If you decide that you want to plan a birthday party at your house, you need project management skills. If you decide that you want to help, be on the committee to improve the EHR system, that requires project management skills. So those are the kind of opportunities you should be seeking from your employer. Will your employer compensate for that? You have to inquire about that. Okay. Embrace technology. Embracing technology is very, very important. I said it before. I was working with a manager who was not comfortable with Excel. And when I say she's not comfortable with Excel, I want to be clear. Do I believe that some of it was her stepping off and saying, I want you to do my work? Of course. But a lot of it had to do with the fact that because she wasn't practicing to speak to those numbers, she wanted those numbers to be reported to her. Her goal was that she wanted the person, myself, who was managing the senior analyst team. She wanted me to take my focus off these team of nurses who, mind you, I was training those nurses within this large healthcare plan to understand what it is to be a nurse analyst. That I was already focused on that. So it's for me to be focused on training those nurses on what it is to be a nurse analyst, to actually look at data, look at databases, using Excel. Like training them on that was my job. And then you're saying to me that you need me to report numbers to you because you don't feel comfortable reporting on the program. And so essentially what I did is I created a system where the very things that I was training those nurses on, I would just put all of that information together and I would report that information to my manager. But again, my manager could not really give me too much feedback to improve where I was going because what I was doing, because most of what I was doing was really giving her the numbers so she can report to her stakeholders. But she didn't necessarily feel to her leadership, but she didn't necessarily feel comfortable with coming up with those numbers herself. And so you have to be comfortable with databases, looking at information for yourself, especially if you're going in a leadership role. Because the truth is, I take my role serious. I take my role serious. That is the reason why I was certified. But imagine if I was not certified in health information management. Imagine someone who, you know, has the role because they knew the manager. The manager couldn't have that expectation that they're going to be getting reliable numbers or have a reliable system. And in fact, even if my system appeared to be reliable, I could not benefit from the feedback of a manager telling me, well, you could change it this way or improve it that way. She couldn't. She felt in a lot of ways that she could not give me feedback because she did not have the knowledge to do that. And so it's very important for you to feel comfortable with technology. Things have only become more digital. The data that we're managing for patients has only become more accessible through technology and processed through technology. So any nurse who is saying, "Oh, I don't want to deal with technology and I don't want to do all the computers," you're just taking yourself more and more away from the opportunities of growing as a nurse because things are only going to become more technical. And so also preparing yourself mentally and emotionally. It is very difficult to transition from role to role. Being new at any place is difficult. You have to make friends. You have to know when to speak, when not to speak. There are some systems, processes, and programs in place where it's very difficult to know who to communicate to. And so, therefore, you may spend time feeling isolated and trying to really read the room, who's available. I've worked at places where I thought I was going to have a manager who was going to be accessible and available. And instead, I had a manager who was so completely wrapped up in the work that she had to do that she didn't speak to me for a whole entire month, actually, a little over a month. And I wound up leaving that role because I didn't feel that I was going to have success in that role because it started off so bad. To have a manager direct you to the onboarding trainer for a week. And then after being released into, the system, because I was working remotely, but I was being released into the system. And now I'm going to just have to do everything I learned in that 1 week of training. That's an impossible ask, in my opinion, because I believe that when you go into production, the only thing that happened when you went into production is that you were released into production. No one tested to find out if myself or the other nurses who were hired into this program, if we actually knew what we were doing. It was just like, here's a software, here's how you access the software, this is where the information needs to go, this is how you upload things, this is how you communicate with this person or that person, and that was it. And so, it's important for you to know how to connect with peers, feel comfortable. I'm big on reality testing. You never really know how much you have in common with other people in your experience, in the same experience as you, unless you talk to them. And so I found that many times when you're confused and overwhelmed about something, there are people who there feel the same way you feel. And if you don't say anything, you're just not helping yourself, but they actually probably feel the same way you feel. Most of the times, if you're going through a training and you feel like the training is unclear and people haven't been giving you enough time to test what you know, or if you felt like the onboarding process was too short or too long or too involved or not involved enough, or you don't have enough support. Most other people in that process with you feel the same exact way. So reality testing is very important. So these are just the, I guess, 6 points that I have for nurses who are interested in transitioning, and specifically transition to HIM, where you'll be working alongside your peers and colleagues, but in a very different way. You'll be collaborating in a different way, with the focus still being on improving patient outcomes.
We want to hear from you. Schedule a free consultation or send us an email at advancednurses@acd4n.com or visit our websites www.advancednurses.info or www.acd4n.com.